Now, just days after the Hooch tragedy in Bihar, corruption in basic public healthcare system has been exposed at the root level in Bihar. Exclusive documents accessed show that even newborns and pregnant women are not spared. These babus, reportedly for a minuscule amount of money, play with the lives of villagers, as per the report. And one of the prominent reasons of malnourishment in the state, as well as in the country, is the money that is collected by the child development officers in their district. The babus and supervisors reportedly are deployed to recover money from Sevika Didis of the Anganwadis. Now, in fact, the rations meant for nourishment of children and mothers are not supplied in full. This is another key point that's been depicted in this report. And this issue, although looks small, but is a major reason of a policy failing at the ground level. Now, we are going to be connecting with a reporter from the ground to get you more details on this big exclusive. But essentially, what we're trying to tell you is that after the Hooch tragedy was witnessed in Bihar, there's now corruption that's coming to light. And this is something related to the basic public healthcare system, which is a very serious matter. Now, as per the exclusive documents that we've been able to access, it shows that even newborns and pregnant women are not spared. Now, apparently, as per the report, one of the prominent reasons for malnourishment in the state as well as in the country is the money that is collected by the child development officers in their district. Now, the babus and supervisors are deployed to recover money from Sevika Didis of Anganwadis, and when it comes to the rations meant for the nourishment of children and mothers, they're not supplied in full. And that's why we're saying that newborns and pregnant women are not spared, because they're not getting the rations that they are promised. Now, while this issue does look small, it is a major reason of a policy failing at the ground level. And to get us more details, we will be joined in by a reporter very shortly. But as per the exclusive information that we have, the malnourishment rate is very high, and this is essentially a big failing when it comes to the state policy of healthcare. And healthcare is something which is very basic when it comes to taking care of the people of the state. And if corruption has been exposed, well, we will try to get you more confirmed details of this corruption. It is a big lapse when it comes to the healthcare system of Bihar. And remember, this comes just days after the Hooch tragedy, and which had to do with spurious liquor. And as for the death toll in the Hooch tragedy, that had gone beyond 70. To get us more details about this exclusive report, we're going over to CNN News 18 Saurabh Rathore. Saurabh, can you tell us more about the corruption in the public healthcare system?
See, Aisha, according to the UNICEF report, India has the maximum number of malnourished children. And I'm not saying that this is the reason, this is the only reason behind it, but it can be one of the prominent reasons why the children below 6 years, they are malnourished in India, because Anganwadi is responsible. It's a central government project that was launched in 1975, and in every state, Anganwadi was set up. And in fact, the reach is so much that in the blocks we have Anganwadi, which looks to the the primary health of children and their mothers. So in this, the Anganwadi workers, they supply medicines and the ration, the nutrition that is provided to the families, underprivileged families, to make ensure that proper nutrition is given to them. Now, this video that we have got is one of the examples that shows how a policy which was made for a good cause, is not implemented properly at the grassroots level. In the video, we can clearly see the Anganwadi workers. They are, they are giving money to their officers, to their supervisors, because it has been recovered on a monthly basis. And it is alleged that the CDPOs, the DPOs in this, who is the head of that district, they collect money from these supervisors.
All right, so we're trying to reestablish that connection with our reporter on the ground, but essentially it's about a big corruption that has been exposed when it comes to the healthcare system in Bihar. And the people who are vulnerable in this are newborns and pregnant women, because what's happening is that apparently the rations that they're promised, they're not being delivered. And due to this, the impact of this is that subsequently they end up being malnourished. Now, remember, this comes days after the Hooch tragedy, where the reported death toll was actually over 70, even though the government's numbers were somewhere around 30. We will be trying to connect with a reporter to get you more details on this. But actually, change of plans, we do have a reporter back on the line with us. Saurabh, so essentially we were also talking about the Hooch tragedy right now. But while we do want to keep our focus on this corruption that's now been exposed, do continue with what you were saying before.
Yes, what I was telling that this policy was was started in 1975 to ensure that proper nutrition and nourishment should be given to the underprivileged in villages, and because of that, this Anganwadi system was set up. Now, this video is one of the example of how the corruption is going on inside the villages, inside blocks, and in the districts, which is not seen by many. Now we have got the video which clearly shows how Anganwadi workers, they from their minuscule salary, they give their cut to the supervisors. Now the supervisors, take this money to the DPOs and the CDPOs of the district, who are, the head of Anganwadi of that area. So this clearly shows that this is not only happening in one part of Bihar or in the country, because Anganwadi system is in all the parts of the country. So this can be a major reason why basic nourishment, the ration, and the nutrition is not provided to the underprivileged children below 6 years. In fact, Anganwadi is also responsible for taking care of pregnant mothers and those who have children of age less than 6 years. So this video, when it has erupted, it is an example of how a policy which was made for a good cause is not implemented on ground level, Aisha.
Saurabh, I do have one more follow-up question for you. Now, have authorities in the state taken note of this? Is there a probe that's going on currently, or has no action been taken yet?
See, we have talked to the MLA of that area, Rinku Singh. He told us about this story, and then we got the video. Now, MLA Rinku Singh is complaining that he has complained a lot many times to the DPOs and the CDPO of the area, but this complaint was not taken seriously by them. And this is latestly the video is of November last month, so we can see that the corruption is still going on and no action has been taken yet. Although we have been informed that the MLA, who comes from JDU itself, is going to submit a letter and is going to show a report to the Chief Minister of the state and see how the action has been taken.
All right, Saurabh, thank you for those details, but I want you to stay with us because we're getting some more breaking news.